ahead, you can see. Okay. Hello, thank you for joining us for the walk-in clinic. This is Facebook Live in the walk-in clinic in the Cathcart building. I'm Kelly Simone. I'm a board certified physician assistant. I've been practicing for 20 years and 16 of those here at Cody Regional Health walk-in clinic. We have 4 other providers that work in the department with us. We have Steve Bischoff, Robert Lang, Dan Fong, and Betsy Nettermeyer, all certified physician assistants. So if you come in, you will see one of us. We alternate shifts and keep the clinic covered. So anyway, we just want to thank you for tuning in and talk about some of the changes that we've seen over the years. There's been a lot. Talk about some of the services we offer, our hours of operation, and then maybe give you a little bit of a tour of the clinic. So we're a walk-in clinic. You don't have to have an appointment to come into the clinic to be seen. We have on-site radiology, and we also have the ability to draw labs. The labs, if we take blood from you here, are couriered over to Cody Regional Health Lab, and we get your results same day. We also have the ability to do point-of-care labs. So in this department, we can do influenza A and B testing, RSV testing. We do have the ability to do rapid COVID testing. We can do urinalysis, urine pregnancy, RSV. So we can run several tests in the department and get results while you're here visiting us. We also do rapid streps. That's one I didn't cover. Some of the common complaints that we see in here are upper respiratory, so sore throat, earache, sinus pain, cough, pneumonia. You can come in with any of those. We see non-severe headaches. If you have a severe headache, we always say you should probably go to the emergency department. Non-severe injuries like sprains and strains, fractures. We see abrasions. We see skin abscesses, lacerations. We will see you for non-severe abdominal pain. We can do a workup for that. We can see you for urinary tract infections, skin problems like rashes, minor burns, skin infections, and I mentioned abscesses. Sometimes we have to do a procedure where we numb the skin and drain some abscesses. If you present to the department here with a complaint that is more appropriate for the emergency department, we are able to contact the emergency room physician and staff and let them know that you'll be coming over. Sometimes we can send you by ambulance, and if you're stable, we can send you by private vehicle. We also do a lot of referrals to specialists in the area, so we have a good working rapport with our orthopedics, cardiology, internal medicine, and some of the primary care providers. Any chronic conditions we generally don't see here. We just are mostly for acute symptoms that you cannot get into your primary care provider for. But for chronic problems like diabetes, hypertension, chronic thyroid illness, and things like that, we recommend that you follow up with your primary care provider. We have a large influx of patients in the summer months during tourist season. We also have seen some growth with a lot of people moving in to the Cody area. So our wait times a lot of times can vary. We're kind of first come, first serve. So like I said, there's no appointments. So if we have a high volume of patients, your wait times can be longer and just fluctuates based on how many people have checked in. Our hours of operation are Monday through Friday, 8 a.m. to 6:30 p.m. Saturdays we're open from 9 a.m. to 5:30 p.m. and Sundays 9 a.m. to 3:30 p.m. There are times when staffing issues can arise, and that may alter our hours of operation. And when that happens, you can always find information on the Cody Regional Health Facebook page, our Instagram page, or on the website. The way we're staffed here in this department, like I mentioned, we have certified physician assistants that run the department. We have close contact with our supportive ED physicians, emergency department physicians. So if someone needs a further workup, we are just a phone call away from talking to one of our colleagues in the emergency room. We have a registered nurse on duty who's available during all operating hours. We also have medical assistants that help with patient care. We have an x-ray tech that's on every shift, And so we are able to perform on-site radiology services, plain films if you've injured your arm or sprained your ankle. We do have an x-ray tech here who can take you back and get an x-ray while you're here. And we also have an office professional who helps with registration. One of the big things that people have asked about and talked a lot to us about in the recent past, over the last year, is COVID-19. We are set up to see COVID patients here in this department. We've kind of had to grow with this process as it's changed over the course of the last year. During the winter months, in the past winter months, we had people come by appointment, but we've now moved away from that model with tourist season and people getting immunized. So we ask that patients with respiratory symptoms ideally come in the first 2 hours we're open. So Monday through Friday, that's 8 to 10. And on the weekends, again, 9 to 11. However, we're not requiring appointments anymore, so it's first come, first serve again. But with COVID-19, we will see you with respiratory symptoms anytime throughout the day, as long as our staffing resources can accommodate the other patients that are coming into the department as well. So the purpose of trying to have people come in during the first 2 hours is, again, just to help manage staffing and patient volumes, but also to conserve personal protective equipment or PPE use that we do throughout the day. We have 2 rooms, and we can take you on a tour of those in a few minutes, but we do have 2 rooms that are established for respiratory patients. Our process right now is if you do have respiratory symptoms like runny nose, sore throat, cough, fevers, even diarrhea, any of those symptoms, we have you call the clinic. Our numbers are posted on our outside signage outside of the Cathcart building. We have you call the clinic for no contact registration, and you'll talk to our front office staff. They will take your insurance information and your complaint, what you want to be seen for. And then when the nurse is available, the nurse takes your history over the phone as well. And then we don PPE, and the nurse comes out to get you on it from a different entrance. So respiratory patients are being brought into the department through a different entrance than patients who are non-respiratory. They come in through a side entrance, and then you're put in a room, and the nurse will take your vitals, and then the provider dons PPE, and then you'll be evaluated. I want to make sure I'm not missing anything I'm telling you. For the active COVID cases in Park County, the current numbers that we have right now are that there are 16 active cases. We've had 22 cases of variants that are reported to date. We have 14 of the UK variant, 4 of the New York variant, and 1 of the Delta variant, which is the more concerning variant that it's starting to be reported. You may have seen in the news. We also have reported 3 Brazilian variants. So we are seeing COVID. We are continuing to see COVID, and we see respiratory patients every day. We are able to do COVID-19 testing here. We have a couple of different options for testing. The main one we use is a BD Max COVID test. It is a PCR test, so it's a highly sensitive test. When you come in, it's a nasal swab, so the Q-tip will go up your nose, and then the sample will be sent over to the lab. That test takes 3.5 hours to run. So we typically run the test and then ask you to go home and quarantine until we call you later with the results. The lab states that the BD Max COVID test is about 98 to 99% sensitive. It's a test that looks specifically for the human SARS-CoV-2 RNA. And it's highly sensitive because it's replicated over several cycles to pick up the virus in your nasal secretions. We also have the ability to do rapid testing, which is another PCR test. That test takes about 15 minutes. It can be run in the department. That test is a little bit different than the BD Max COVID because it's modified. It doesn't go through replication cycles to detect the virus, but it is still, our lab is reporting about 90% sensitive, so we're able to run that test as well. In this department, though, we do not do any asymptomatic testing. So that means if you just need a COVID test because you're going on a flight or you need it for a pre-op before you have a surgery, or you're just wondering if you have COVID but you don't have symptoms, we don't do that testing in this department at this time. So we wanted to also mention to you that if you're looking for that, Walgreens is taking appointments for COVID-19 testing. You can go online or use their app to do that, and it's a PCR test as well. And also there is now the availability of a antigen test that's over the counter. You can purchase it at Walmart. I don't know if Walgreens stocks it. I do know that Walmart does. That's called Binax Now. It's an antigen test. You take 2 tests 3 days apart. The sensitivity on that one is a little bit lower. It's 62 to 64% sensitive if you're symptomatic and around 34% if you're not. So that testing is an option, but if you're just looking for asymptomatic testing, those are some other options that we have. And talk to you a little bit about the process again with some of the changes in the walk-in clinic. We've had, patients sometimes worry, am I going to go in and be exposed to COVID? And we know that's a real concern, so we've made it real effort to make sure that our well patients are seen on one side of the department, and then respiratory patients are seen on another side. We do keep people separated. The 2 rooms that we have in this department are negative pressure rooms. Right now, the negative pressure is created with a portable HEPA filtration system. So if you've been in, you've seen the machine, and we'll show it to you here in a few minutes, that filters our room for contaminated air. And if you've driven by, you've probably seen on some of our rooms, there's a tube that's vented to the outside that pushes the contaminated air to the outside. So those rooms are separate. If you're here for non-respiratory complaints, you'll be put in a different room. What else can we talk to you about? We do have some upcoming plans. That the portable HEPA filtration system, if you've been in, they're a little bit loud. They have a hum to them. So Cody Regional Health has decided to move forward with converting our 2 rooms to permanent negative pressure rooms. And that process, it's a construction process that we have to go through in about 2 weeks. On August 10th, the construction will start to take place. And so for that part of the time, our rooms, those 2 rooms will be closed off so they can be converted. And then we'll make another room. We have another exam room that we're going to convert with the portable HEPA filtration system. So we'll just still keep the same system. You'll still be separated. You'll still have a separate room. But it'll just be a little bit of a hiccup in the process while we're waiting for the permanent conversion to the permanent negative pressure room. So we wanted to make you aware of that. We also have some respiratory therapy has provided us with some respiratory tents that are like a filtration system as well that can be used in a non-negative pressure room. So we do have that adaptability as well. We can give you a little tour of the department if it's something you would be interested in. I'm going to have Ashley kind of follow me around with the iPad so we can show you what it looks like. Right now we're standing in our procedure room. This is where we would do like laceration repairs, abscess draining. We have, I can show you some of we have splinting supplies in this area here for fractures and sprains. We have suture material where we can suture you, steri-strip you if you have lacerations or anything of that nature. So this is our procedure room. And then I'll take you into the area where we see respiratory patients. So first, let's show you that this area is taped off. So the red denotes that this is a respiratory area. Right now there's clearly no patients back here. And it's separated from the front of the department where a non-respiratory patient would come in. This is where the area where the provider and the nursing staff will don PPE. So this is kind of the clean area where we would get ready to come see a respiratory patient. And then I'll take you into our room here where the negative pressure is so you can see the HEPA filter. This is the door that you would come through here for the alternate entrance if you have a respiratory complaint. And this is where we can run some of our rapid testing for influenza, RSV, strep, and rapid COVID. Okay, and then this room, here's our negative pressure room, and you can, I don't know if you can hear the hum of the HEPA filter, but this is what it looks like. This is the HEPA filter. So you can see the tubing is piped here to the outside where so this filter will pull the contaminated air, filter it, and then send it to the outside. And this room is cleaned extensively between patients, and what this HEPA filter does is it creates a negative pressure in this area. So the air pressure in this room is lower than the pressure outside, and air will move from higher to lower pressure. So when this door is open, the air in this room should not exit into the area of high pressure, so the contaminated air would stay inside this room, and the air from the clean side, if you will, would move into the room. If we can take you outside real quick and just show you the process where we have people come. This is the west side of the building, so when you call if you have a respiratory complaint, we ask you to drive around to this side of the building. Tractor Supply is on this end, and Walmart, and you would come in through this door. And Ashley, if you can show this number here. There's a big red sign here that tells you what phone number you would call if you needed to be seen, and your call would be answered by our front desk before being passed on to the nurse. And then if we can take you over here and show you just quick that we have the on-site radiology area where we can do x-rays. So we have on-site radiology in this area and the capability to do many x-rays in this. If you needed something like a CT scan or an ultrasound, we can place that order in this department, and then we would send you over to the main campus for those studies. But we have the capability to do plain films in this area, which are read by the radiologist, and we usually have a report before you depart from your office visit. So again, our office hours are Monday through Friday, 8 a.m. to 6:30 p.m. And then Saturdays, 9 a.m. to 5:30 p.m. and Sundays, 9 a.m. to 3:30 p.m. We are located in the Cathcart building across from Walmart on the first floor in Suite 120. We're here for you if you need anything. And you're always free to call if you have any further questions about COVID testing, our registration process, or anything that you're concerned about that you would like answered ahead of your visit. Ashley, do we have any questions?
If anybody has questions at this time, we'll just give you about 10 to 20 seconds to get those written in. And if you can't think of a question right now but want to come back later, please leave a comment below and we will reach out directly to Kelly and get that answer for you. So we'll give everybody just a few minutes here. I've got a question while everyone's maybe thinking. How long does the antigen stay in your body? So if you were to go get that test to see if you've had COVID in the past, do you know how long that stays in your body?
So if you wanted to see if you'd had COVID in the past, then you would need an antibody test.
Right.
To see if your immune system had mounted an antibody response. And so there's not a lot of clear data that has really told us for sure how long you have antibodies, but the estimates are around 90 days.
Okay, all right, I thought so, and that's not the test that Walmart has.
No, the test that Walmart has looks for the antigen that your body produces to try to fight the virus. We'll look for that, which is a little bit less specific than looking for the actual RNA components of the virus itself, which is what the BD Max test looks for.
Perfect. Okay, I don't see any more questions coming in, so thank you everyone for watching. And Kelly, thank you so much for your time.
Yes, thank you.
All right, have a great